Okay, well, one of the questions we had this morning while we wait for everybody to come in is what about complications? And so we're going to talk a little bit to answer your question and give you a broad overview, and then if we want to dive in more deeply on any individual topic, we'll do that. But what about problems and complications after the surgery? Well, again, there's early and late. And what does that mean? What does early mean? Early is usually in the first 10 to 14 days. Maybe up to even 30 days. And after that, we generally refer to anything in the next 10 years as late complications. And the problems in those two time periods are different. And so we'll talk about early first and then talk about late. At the time of surgery, in the operating room, bad things can happen. Complications can happen. So things like bleeding, trouble putting the breathing tube in, anesthetic, drug reactions, and things like that. And those complications, in our experience, are very, 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 very low. In our almost 4,000 patients, intraoperative complications have occurred in only one or maybe two people. So it's very unusual. So some people worry about the anesthesia, and we take it seriously, but it's a little bit like flying in a jet airplane. Most of the time, although trouble can happen in a flight, it's very rare. And so intraoperative complications are very uncommon. After the surgery, the things we worry about are things like bleeding, infection, clots, leakage of the plumbing connection, and those are kind of the big ones that we have our most worry, most concern. Almost all of them, when they happen on the first day after surgery. The rate of complications after the first day follow a logarithmic decline. Remember logarithms from high school? And so logarithmic means almost everything is in the first day, a few in the second day, almost none on the third day, and a fairly small trickle of rare complications up to a week or 2 weeks after the surgery. But again, intraoperative complications uncommon, and they can be airway, anesthesia, drug reaction, bleeding, things like that. The other complications, the big early complications we worry about are bleeding, infection, leakage of the connection, blood clots, things like that. Almost all of them occur on the first day, and the rate of complications declines rapidly every hour and every day you get further from the surgery. And when we've analyzed it, it actually follows a mathematical model that can kind of make some common sense. It basically drops off quickly as you get further from the surgery. And so, in our experience, we have done something unusual, and that is we send our patients home the day after surgery, in most cases. In your case, you won't go home, but you'll go to a hotel. And one of the questions you might ask is, isn't that dangerous? Couldn't your patient, Dr. Rutledge, have a complication or a problem? And in our experience, we have never seen an urgent or emergent complication. What I mean by that is you may have seen on TV or had experience with somebody who has an emergency medical problem. Your heart stops. You have a stroke. You stop breathing. You have a seizure. Those kinds of things are emergency, 911, need to be in the hospital type of emergencies, and we've been very fortunate. We've never had that kind of complication. Not that I'm superstitious. Is that wood? Now, you can have complications after our surgery, and we have seen them, as I described, following a logarithmic decline on the days after surgery. And those complications that we have seen have been problems in some patients, but they've always been problems in which you could drive back to the hospital, come and see us, and we could take care of them. So, what we found, it is safe, in our experience, to send you to the hotel the day after surgery if you feel well.